Adempas, Riociguat uses, mechanism and side effects explained. What is Adempas, Riociguat? Adempas, also known by its generic name Riociguat, is a prescription medication used to treat specific types of pulmonary hypertension, a form of high blood pressure that affects the arteries in the lungs and the right side of the heart. Specifically, Adempas, Riociguat, is approved for the treatment of pulmonary arterial hypertension, PAH, and chronic thromboembolic pulmonary hypertension, CTEPH, in adults. Adempas, Riociguat, comes in tablet form and is typically taken by mouth every 8 hours. Common side effects include headache, indigestion, and dizziness. Because Adempas, Riociguat, can cause serious harm to unborn babies, it is only available to females through the Adempas REMS program, a restricted safety system that ensures appropriate use and monitoring. What is Adempas, Riociguat used for? Adempas, Riociguat, is prescribed for 2 main medical conditions in adults. Pulmonary arterial hypertension, PAH, a condition where blood pressure in the lungs arteries is abnormally high, leading to shortness of breath, fatigue, and chest pain. Chronic thromboembolic pulmonary hypertension, CTEPH, a rare type of pulmonary hypertension caused by blood clots that obstruct blood flow in the lungs, even after treatment with blood thinners or surgery. How does Adempas, Riociguat work? Adempas, Riociguat, belongs to a class of drugs known as soluble guanylate cyclase, SGC, stimulators. It works by stimulating the enzyme SGC, which helps the blood vessels in the lungs relax and widen. This process improves blood flow, reduces pressure in the pulmonary arteries, and allows the heart to pump more efficiently. As a result, patients taking Adempas, Riociguat, often experience improved oxygen delivery, better exercise tolerance, and reduced symptoms of breathlessness and fatigue. Side effects of Adempas, Riociguat. Some side effects of Adempas, Riociguat, may improve over time as the body adjusts to the medication. However, any persistent or worsening symptoms should be promptly discussed with a healthcare professional. Common side effects: headache, 27%. Indigestion or stomach irritation, 21%. Dizziness, 20%. Nausea, 14%. Diarrhea, 12%. Low blood pressure, 10%. Vomiting, 10%. Anemia, 7%. Reflux or heartburn, 5%. Constipation, 5%. Other reported side effects: stuffy or runny nose, nosebleeds, difficulty swallowing, abdominal bloating, swelling in the arms or legs, edema. Serious side effects: seek immediate medical attention. Severe low blood pressure, dizziness, lightheadedness, fainting or pale skin, severe bleeding, vomiting blood, black or tarry stools, severe stomach pain or fainting, worsening lung blockage, chest pain, shortness of breath, irregular heartbeat, sweating or coughing. Typical dosing for Adempas, Riociguat. The typical starting dose of Adempas, Riociguat, is 0.5 mg to 1 mg taken by mouth 3 times a day. Depending on how your body responds, your healthcare provider may increase your dose gradually every 2 weeks. The maximum recommended dose is 2.5 mg by mouth 3 times daily. Your provider will determine the right dose of Adempas, Riociguat, based on several factors including how effectively the medication is improving your symptoms and pulmonary blood pressure, whether you are experiencing any side effects, if you are taking other medications that might interact with Adempas, Riociguat, whether you smoke, as smoking can decrease the effectiveness of Adempas, Riociguat. It's important to take each dose exactly as prescribed and to maintain consistent timing between doses to keep a steady level of medication in your body. Never adjust your dosage without your provider's guidance. Adempas, Riociguat. Contraindications. Certain health conditions or medication combinations can make Adempas, Riociguat unsafe to use. These are known as contraindications, situations where the medication should not be taken due to serious safety risks. Do not take Adempas, Riociguat, if any of the following apply to you. Pregnancy. Adempas, Riociguat, can cause severe and potentially life-threatening harm to unborn babies. Women of childbearing potential must use reliable contraception and enroll in the Adempas REMS program before starting treatment. Concurrent use of nitrates or nitric oxide donors, such as amyl nitrite, combining these with Adempas, Riociguat, can cause dangerously low blood pressure. Use of other SGC stimulators. Taking another soluble guanylate cyclase stimulator along with Adempas, Riociguat, is not safe. Concurrent use of phosphodiesterase, PDE inhibitors, such as sildenafil Viagra, or theophylline. These combinations can result in severe drops in blood pressure and are strictly contraindicated. History of idiopathic interstitial pneumonias, PHIIP Adempas, Riociguat, is not recommended in individuals with this condition due to safety concerns. Before starting Adempas, Riociguat, always discuss your full medical history, all medications you take, and any underlying conditions with your healthcare provider to ensure safe and effective treatment. Pharmacist tips for Adempas, Riociguat. When taking Adempas, Riociguat, it's important to follow your healthcare provider's instructions carefully and maintain regular medical appointments. Mark your follow-up visits on your calendar. These check-ins are essential to review your progress, adjust your dose if necessary, and ensure that Adempas, Riociguat, continues to be safe and effective for you. You can take Adempas, Riociguat, with or without food, but try to take it at the same times each day to maintain consistent levels in your body. Because Adempas, Riociguat, can sometimes cause nausea, taking it with food may help minimize stomach discomfort. If you have difficulty swallowing the tablets, they may be crushed and mixed with water or soft foods such as applesauce immediately before taking your dose. Do not prepare doses in advance. Adempas, Riociguat, may lower your blood pressure and cause dizziness or lightheadedness. Make sure to stay hydrated and stand up slowly from sitting or lying positions. Avoid driving or operating heavy machinery until you know how this medication affects you. Inform your healthcare provider if you're taking other blood pressure medications or if you experience dizziness, fainting, or severe fatigue. Although uncommon, serious bleeding can occur while taking Adempas, Riociguat. Watch for warning signs such as vomiting blood, nosebleeds, or black tarry stools. If you notice any unusual bleeding or bruising, seek immediate medical attention. Adempas, Riociguat, can interact with a variety of other medications. Always tell your healthcare provider or pharmacist about all prescription drugs, over-the-counter medicines, vitamins, and supplements you are taking. Avoid taking antacids containing aluminum or magnesium, such as Mylanta or Rolaids, within 1 hour of Adempas, Riociguat, as these can interfere with absorption and reduce effectiveness. Never start a new medication, supplement, or herbal product without consulting your provider or pharmacist first. If you are a female of childbearing potential, you must use 2 reliable forms of birth control while taking Adempas, Riociguat, and for at least 1 month after your final dose. You will also need to take a pregnancy test every month during treatment. Contact your healthcare provider immediately if you become pregnant, as Adempas, Riociguat, can cause serious harm to an unborn baby. You should not breastfeed while taking Adempas, Riociguat, or for at least 3 days after your last dose, as it's unknown whether the medication passes into breast milk. If stopping breastfeeding is not an option, discuss alternative treatments with your provider. If you miss a dose of Adempas, Riociguat, simply skip it and take your next scheduled dose at the regular time. Do not double your next dose. However, if you miss 3 or more consecutive days, contact your healthcare provider before restarting the medication, as your dose may need to be readjusted for safety. Adempas, Riociguat, is an effective therapy for pulmonary hypertension when used correctly under medical supervision. Following dosing instructions, maintaining regular checkups, and reporting side effects early are key to maximizing the benefits of treatment while minimizing risks. If you found this information helpful, make sure to subscribe to HeInfo, your trusted science-backed health education channel. Like this video to support accurate health content. Comment below with any questions about Adempas, Riociguat, or your experience with pulmonary hypertension treatment. And share this video to help others stay informed about their health.